Health assessment. So this is the different part of the process. And it starts at ACC, Animal Care and Control. We have an intake team here. This is George and our CBT, KT. And there she'll do the, George is very involved with doing temperament testing, and KT will be there more from the health aspect. So she's going to do a physical exam. And it's not that we don't pull sick animals, but we like to be proactive and know what we're bringing in. So if we have an animal that has severe periodontal disease, has mammary tumors, maybe bladder stones, then there's no surprises. We know that we're going to be doing blood work on them initially as far as to make sure that they're healthy. And also she does some diagnostics there, such as heartworm for the dogs. While there we couldn't get a miticide. So it's important that if we're bringing in a heartworm positive dog that we know that we can treat it appropriately. Things like that. So CBT does the initial medical assessment, like I said, some diagnostics. For the cats, we'll do the triple test, so the feline leukemia. We do bring in FIV. Sometimes they jump up and down when we've got FIV positive, but feline leukemia we do try not to bring in unless we think it's a kitten that might convert and eventually test negative. But and then CBT confirms and finalizes, just gives a call before she heads back to rescue and recovery, lets her know that what we're bringing in. So this is their physical exam, the CVTs, and it just shows a couple of things as far as some of the diagnostics that they might do, whether it be cat or dog. Body score gives us a rough idea. Physical exam, if there's anything that really stands out, and their comments, needs a shave down or what have you. This is Dr. Campari. She's our second fellow. And so discipline and consistency, such as the process, documentation, decision, are vital to population management. And this is key here. Be flexible, proactive, diligent, and smart in your daily practices. We just keep trying to figure out how to do it better, how to do it more efficiently, and that really helps. And very flexible. It's a very dynamic process. The whole shelter setting is almost like a living being, and it's up to us to kind of keep a finger on the pulse. And there's going to be times where we have outbreak. It might be ringworm, it might be pan-luke, where we have to kind of step up. It might be just cat diarrhea or something like that, where we'll kind of adjust depending on the pulse of that living being. So. Rescue and recovery. Intake team weighs and puts assigned areas on the assigned areas. They put the signage. And what that does is it just helps us. Once we've got a weight on them, we can set up for them so when we get the animals out, we're ready to go. Signage might be if they're going to be fasted. If we have a nursing mom, we know that she's not going to go to surgery the following day. There's no sense of putting up the sign saying, NPO kind of thing. Treat a variety of things as far as some of the parvoviruses, ringworm, heartworm, upper respiratory, skin disease, cancer, somewhat limited as far as surgical removal usually, diabetes, hyperthyroid. This is our sheet that we I redesigned it because the sheet that I had before, the physical exam, was kind of a general physical exam that you might find just in private practice. And to me, a physical exam that's done in a shelter is still very thorough, but it's, you're focusing on some of these different things. So especially when I have a doctor that's there that maybe isn't normally with us, it's important for me to know that they're looking at things like oral ulceration, as far as looking for caleci, that they don't have crust, because again, we might be a little bit more sensitive to looking for ringworm. So it's important for me to kind of customize this protocol, customize this physical exam sheet. So if they're lame, that we're looking for some of these things and making a note as such. Doxy, you could see we use a lot of it is on our permanent physical exam sheet. So again, this just kind of expedites things that I don't have to write it 200 times. And then usually, this is important, this gives them direction as far as where they're going. Does the foster coordinator then look at this and say, okay, I circled foster and I put 2 weeks, or I put foster coordinated and I'm worried about it, so I want to see him back in 5 to 7 days. So again, it just gives them direction as far as what's happening with this dog, or we have a sheet also for cat. And then health assessment, they then go down to if they're cleared for spay-neuter, if they're done with their 2-week hold, if they're slow-tracked, Then they go down, spay-neutered. We also do surgeries for the public as far as just spay-neuters. Nothing else is done for the public as far as that goes. Special ops, usually on Fridays we'll have, that's a slower surgery day where we don't have a full staff. It might be one technician and the surgeon. And we'll do things like cystotomies or mammary tumor removals or enucleations or amputations or full mouth extractions for stomatitis or something. So that's kind of how we're set up. And the things that, so we've done a lot of outside care. We've brought a lot of outside care in. The only thing that we really send out would be the, so say it needs a lens enucleation or something, lens extraction, or orthopedic, say it has a cruciate, imaging, x-rays, and then they're cleared for surgery adopt.